Welcome back to Dr. Moses' YouTube channel, where I bring you the most information on current cases. On today's episode, I'm here with my friend Ronnie, and we're going to talk to you on today's episode about the 7 symptoms and signs that you should never ignore. Number 1, if you have an unexplained weight loss, you are not on any weight loss medication, you are not on any diet, you are not exercising vigorously, and you are losing weight, let's say between 6 to 12 months, you've noticed about 10% weight loss, that is a very serious sign. You should go in and get checked. You have certain conditions like hyperthyroidism, that's overactive of your thyroid. You could have diabetes. You could have liver disease. Depression can actually cause that. And also the most serious ones is cancer can do that. So any unexplained weight loss, unintentional, is a warning sign. Number 2, if you have acute shortness of breath, you can't breathe. I mean, just all of a sudden, you just can't breathe. Or you take a deep breath, it hurts your chest. We call that pleuritic chest pain. If you're having any of those symptoms, unexplained weight loss, it's very serious. It could be a blood clot, it could be pneumonia, it could be a viral infection, it could be even congestive heart failure, where if you experience like unexplained weight gain, your feet are swelling and you can't breathe, you can't climb the stairs, that could be a sign that your heart is not working very well. So you should not ignore that. Go in and get checked. 3, if you're experiencing fever that is persistent. I'm not talking about fever when you have a viral infection, 2 days, 3 days, and it goes away, but I'm talking about persistent fever. Even if it's a low grade fever, like even 37.8, 37.7, and it's just persistent for a long time, that could be a serious sign that something is going on in your body. You could have an infection in your body. Cancer can manifest that way. So if you have unexplained fever, you should go in and get checked. Right, Ronnie? Is that correct? Absolutely. He said it's correct. Or if you have unexplained fever about 39 degrees centigrade, that's about 103 degrees Fahrenheit, and it's persistent continuously for 4 days in a row, it's not going down, go to the ER. Don't be taking ibuprofen and stay home. You could be brewing a very serious infection, and you could even have sepsis. That is an infection that goes through your whole body. So go in and get checked. The next one, if you have unexplained changes in your bowel habits, all of a sudden you're just getting constipated all the time without even eating right, you're just constipated constantly, or you're having diarrhea interchangeable with constipation. If you're having any of those symptoms and it's prolonged, it's going on for a long time, do not ignore it. Don't just be taking Imodium or laxatives to clear your bowels. It could be a sign of very serious illness. In fact, even if you have a thyroid problem, you could have changes in your bowel movement. Or if you're having like what we call IBS, right? And that is irritable bowel syndrome, can do that. Or inflammatory bowel syndrome, IBD can cause that. And the most serious one, the cancer, can be a source of that. So you should go and get checked. The next one is the feeling of fullness all the time. I mean, you eat very little, but you feel very full all the time. We call it early satiety, and you have nausea with it, or you be burping, having those, or you can't swallow. It hurts when you swallow, or food is not going down. Those are very serious signs. It could be an acid reflux. It could be a sign of peptic ulcer disease, or it could be a sign of stomach cancer, or even esophageal cancer. So you should go in and make sure that somebody checks you out. The next one, if you have what we call flashes of light, all of a sudden, you have flashes of light coming, it comes and goes. That could be a sign of what we call retinal detachment. That is the back of your eyes where you see and focuses. It could be a detachment of the retina. So you should go in immediately to see an eye doctor. It could also be a sign that you have a migraine, but do not neglect those symptoms. The last but not the least is back pain that is not from an injury, or a back pain that is just not going away, or it wakes you up in the middle of the night, or you have a fever with it, or the pain is on the spine itself, or maybe just around the spine, or you're having numbness, okay, or weakness in your legs, you can't get up, you get up, you feel like your knees are buckling, you want to fall down, or the pain is radiating to your legs, you have a numbness and tingling, or if you start experiencing bowel incontinence or bladder, you can't get to the bathroom on time, those could be very, very serious sign. You should not ignore it. Make sure you go to see the doctor. It could be a sign that you have a spinal cord compression. You could have something we call epidural abscess, or you could have a disc that is bulging. So go in immediately and get checked. So if this information has been helpful to you, I want you to subscribe to my channel and also share this and hit the like button and leave me some comments on some of the weird symptoms that you're experiencing. Maybe I can explain to you what it is so you can go see the doctor. Again, Dr. Moses, I'll see you on the next episode. Until then, me and my friend Ronnie, we are saying stay well.